Good afternoon, everyone. My name is Catherine Spears. I'm the Division Director with Behavioral Health, overseeing school-based behavioral health programs as well as early psychosis. Today, we have also here with us Sonia Gutierrez. She's our Division Manager with SLS, Guadalupe Ramirez, a Program Manager 2 with SLS, and then April Quijara, a Program Manager 2 with SLS. And today, we'll be sharing a lot about our schooling services programs as well as projects, the initiative and programs. Program updates. We'll start off by sharing with you all about the Children, Youth, Family System of Care overview. We'll go into discussing the SLS multi-tiered systems of support, and then discuss our partnerships with other organizations and entities. We'll share with you all about who are we serving. We'll discuss programs such as prevention and early intervention, and we'll close with just some of the strategic planning and looking ahead for the state of schooling services. We'll have also question and answers available for all of you if you'd like to post anything in the chat or if you'd like to ask questions here. So this is our Children, Youth, and Family System of Care. You'll see here that on the left, my left, the side includes the vision of the Children, Youth, and Family of Care system. It promotes healing, hope, well-being, and improved life outcomes for all. Our mission is to be alongside children, youth, and families in affirmation of the values of cultural humility, inclusion, hope, and equity. Our transformative work is accomplished through coordinated, integrated growth, recovery, and resiliency-oriented approaches. Our continuum of care includes from left to right, the prevention and early intervention, outpatient services, intensive outpatient services, intensive treatment and supports, and residential services. All of our school-based programs, such as prevention and early intervention, schooling services, family engagement program, and SLS behavioral health are more on the prevention, early intervention, and outpatient. So this means that we provide services pretty early on with the young people and students. So we are primarily at school sites at elementary schools, as well as middle schools and some high schools. We provide services on school campuses, as well as in the community or in the home. Additionally, we have two other programs that can be provided alongside these programs, which is our therapeutic behavioral health services. That's accessible for the students who are in schooling services, but they can also receive this program. We also have crisis support services that are available for young people in Santa Clara County, and we can serve both the schooling services programs as well as they can access crisis services. Our partnerships is throughout the county. We have partnerships with the county contracted providers and community-based organizations. We also work in partnership with the managed care plans and the county school districts, as well as partnership with County Office of Education. We, as of August 2023, 25 school districts out of the 32 school districts in Santa Clara County has an SLS coordinator. Behavioral health and as well as County Office of Ed has partnered with a managed care plan to promote and support the Children, Youth, and Behavioral Health Initiative and its efforts to reimagine mental health services in schools. So our programs are at 25 school districts for our Tier 1 services. That's the Family Engagement Program. And we'll talk more about that program and later in the slide deck. Our Tier 1 and 2 services, which is prevention and early intervention, we are at 16 school districts. And our Tier 3 schooling services, behavioral health, we are at 17 school districts. And I will have Sonia share about access points as well as the program specific access points.
Great, thank you, Catherine. So one of the main access points is the Behavioral Health Call Center, and that is 1-800-704-0900. And because we're talking and focusing on school-based programs, main important ways SLS students can access these services is through an SLS coordinator. And so an SLS coordinator with referral will be able to then call the call center along with the student alongside with the parents The SLS coordinator also helps support parents sort of navigate the call center by having prepping them for them to answer any symptomatic signs regarding the call center so that they could share what the student is experiencing, as well as triage whether or not it's a mental health or substance use support that's needed. Once this is processed, then the student and their parent will get a referral, and then the contracted provider will have about 3 days to then be able to contact the parent. In the event that the parent does not answer the phone or they're not able to get a hold of the parent, then the contracted provider will go to the school district and try to access the parent themselves. There's also direct access points through the juvenile justice system and child welfare, and also through our school-based wellness centers. The schooling services program uses a multi-tiered systems of supports, and this basically incorporates academic, behavioral, and social emotional supports. And at our first tier is through our prevention and early intervention program. And this is universal supports to support all students. And so I'll share later on the next slide what that may mean or look like, but we hope to support all students and all families at this level. As we may know, about 75% or so will respond to this prevention intervention. And so then we will move on to tier 2, where then students and families may need more targeted group approaches. And about 25% or so will respond to these services. And so then this is where the contract providers or the schooling service coordinators will refer students to the other levels of tiers, which also includes more of a clinician mental health supports and individual student and or family therapy. And so here are some examples of what the MTSS levels of tiers look like. And for tier 1 is our family engagement and prevention. This looks like mental health screenings to our students to be able to triage for anxiety and or depression, and then to link students to services. This includes some of our evidence-based practices like skill streaming in the elementary school to really help students build skills, help them cope with stress management. This also includes P level 2 support, which also supports parents who maybe there's a few behavioral issues popping up with their child that they're able to support. The SLS coordinator supports a lot of family engagement in this section. And so this is where we have a lot of health fairs or outreaching to particular populations or community events to really kind of share what services are available to their to students and or families. Then we move into the prevention and early intervention tier 2 component, which is again more of that group support that is needed for our families and our students. And this is where there's more of a focused section. So for parent workshops in particular, the P level 3 really shows maybe there's specific behaviors that the parents want to focus on, that they're able to attend a series of events to be able to help support them at home. And this is where case management also is provided. And then at the tier 3 level is more of individual or family therapy. This is where we have licensed clinicians or mental health providers providing direct services. This is also where medication support comes in, as well as crisis intervention. And then I'll turn it over to Lupa to talk more about the SLS coordinator role.
Thank you. Hi, everyone. So I'd like to talk a little bit more about what an SLS coordinator does within our school district. So our SLS coordinator is really primarily focused on these components. And we see that a large part of their function is to service our community with linkage services. And that includes connecting families and students with supports needed internally in our system, in their school district, or in our outside community. They triage referrals to connect students with resources, and they do this on a one-on-one basis through our referral process. We also see that coordinators are involved in our family engagement process, and these are enrichment activities that support the fundamental core of our districts, and that could be a one-time series, a one-time event, a workshop that includes a series around enrichment activities. They also act as a community liaison. They bridge gaps between the services that are provided internally and also partner up with our community agencies to support the specific needs of their district. We see that the focus of a role of a coordinator is to really be an advocate for our families and to understand what the needs are within the environment that they are stationed at. So our role really is an expansive part of an integral part of what our services are entitled, and we are able to see how they fit into the organization of a school district, being with these components. So here we talked about it earlier, the 25 school districts that are involved with SLS are included here. And this diagram shows how each district has fundamental services. We see that FE for family engagement, we have PEI services and SLS. We talked earlier about what they mean in our tier service with our model. And so we have outlined pending school districts also that are about to enroll in our services. And so here you could see how most of our school districts have a bare minimum of a family engagement servicing partnership with us. And that includes getting training and onboarding services through our staff and getting connected to county resources and other partnerships that are available to them. So we want to highlight some of the work that was done last year. And we want to do this by showcasing some of the data that we were able to gather. And we see here in this graph that over 6,000 referrals were serviced last year with our school districts that had a partnership with SLS. We see that the majority of them were referrals around anxiety, and they were followed along with depression and symptomology with conduct issues with our students. So the referrals that are coming in through our SLS coordinators are triaged in a matter where we collect information to see how the resources are being utilized and the gaps that we have within our system. And then we could see here that this great percentage, 49% of them were unduplicated students. So that means that it was one student, one referral, and they were serviced for one of these specific items, among other items like academic services, social emotional support, even parenting support. So this is a good way of seeing what our SLS coordinator is facing when we're talking about the systems that are already involved with our 25 school districts that we have services in. This is also a really nice way to highlight what we're doing through our family engagement event. So we see here that we serviced over 63,000 families when it came to family engagement events that were a one-time workshop. We also see that over 13,000, close to 14,000 families were serviced through a workshop series. And we see that students receive psychoeducational servicing workshops through one of our partnerships with behavioral health, healthcare or resources, accessing various typical resources like food assistance and healthcare. And that number is over 6,000. But we do want to highlight that over 6,000 students had a referral that was successfully linked. So we see that that's over 80% that were successfully linked to some type of service throughout the school year last year. We see that in 2021 to 2022, we increased our family engagement series. So that means that school districts were providing more enrichment workshops and series alongside, and that was a 48% increase in those services. What we're most proud of is that 88% of our families that were surveyed let us know that they found this to be a positive experience for them and that they felt welcome with the school district, they felt welcome with the services of SLS, and that they learned something from the resources provided. So we also surveyed teachers through our skill streaming programming, and we gathered information that 80% of the teachers were satisfied with the services provided through one of our CCPs. So we wanted to bring and showcase some of the work that we do. And here we have a couple scenarios. In particular, we highlighted two. We have a first student, and this really explains how an SLS coordinator would support every case that is brought to this agenda. So we have the case of Jamie. Jamie is a student that is a third grader. She is an 8-year-old, and she was screened for mental health services. She ranged, her scoring came out of the cutoff line. And there was issues regarding when reporting back to the parent reported that she was having issues following directions at school and at home. So what the coordinators did and what support systems through SLS were able to assess was that there was a need for parenting support in our first tier of service with universal access to services. And this was a level of care on prevention level. And that parent was referred to triple P, level 2 seminars, parent seminars, which is a series. They were provided through one of our PEI program providers, and the student received skill streaming to build on their training and coping mechanisms. And they were referred to these services by our SLS coordinator. On the other hand, we have Frankie, who is an older youth. He's 17 years old. He's a high schooler and he's homeless. He was referred to our system through some of the McKinley-Vento liaison services that were provided in the school district. Frankie, on the other hand, had more severe behaviors, and Frankie was showcasing behaviors of suicide ideation. He also experienced need around school attendance and social emotional support with his suicide contemplation. So we see here that he needed an area of support that was more individualized, and he was referred to individual and family therapy, and that is a tier 3 support system. And he was referred to one of our specialty mental health. And so the coordinator was able to do this referral to the student as an individual through our call center partnerships, and was able to refer the family to needed services through one of our most intensive service partnership venues that we have in our venue of services through our behavioral health system. So the family was also referred through a parent support workshop, and we see that this was a multi-tiered service referral that the coordinator had to adjust to where the family was at and also the student needs. So this is typically 2 scenarios that a coordinator would be able to service a school district. And we wanted to showcase the level of care that a coordinator might face from a tier 1 to a tier 3 servicing. So I'm going to turn it over to my colleague April on her slides.
So I'm going to go into a little bit more detail about our prevention early intervention program, which is services that we've already heard a little bit about, and these are specifically provided by our county contracted providers. So we have these services that are available to any student at the available schools. So depending on whether they have commercial private insurance or whether they have Medi-Cal, they may be able to access different types of services within these programs. But I'll talk about that a little bit more in terms of accessing these services. So if we look under activities, we'll see some of the things that were already mentioned, a little bit more about the psychoeducation that we offer. So the psychoeducation was actually something that was added a few years after the prevention early intervention program started in 2012. And that was a result of the changing needs and the trends in the schools, as well as the schools reaching out to county behavioral health for our expertise, the expertise of the contracted providers, to really get information that they can share with their caregivers, as well as the students on a variety of mental health needs. So currently, some of our trends are how to recognize that your student might be involved in gangs or at risk of gang involvement. Another hot topic has been exposure to substance use prevention services that are needed. And many times we'll refer to other county partners who can provide these, but psychoeducation is a big part of our program. So with the mental health promotion, that's a term that we use really for outreach. And so that can be anything from giving a positive parenting, a triple P seminar, to going to back to school night and tabling, to going out to give a presentation for students like a school assembly on bullying. That's something else that's been very popular. Evidence-based practices, we heard a little bit about skill streaming. So what skill streaming looks like is a teacher or school might say, you know, my 5th graders are having a lot of trouble with making friends or being mean to each other. And so we have a whole menu of skill streaming lessons, and the providers come into those classrooms and they do a structured curriculum with role plays. One of my favorite ones is how to accept when people say no to you. I think that's one that the students, and we have a quote later on, have really appreciated. So it's usually 6 sessions. They'll come in once a week and provide that classroom wide, those social skills. And then Triple P is Positive Parenting Program. It's a huge system that runs everywhere from bus campaigns and general promotions to the community to level 2, which is one thing we offer, which is 90-minute seminars, usually in the evenings to caregivers. We also have level 3, which are either individual sessions with caregivers, usually 3 to 4, targeting a specific item. Sometimes it's difficulty going to bed routines. Sometimes it's picky eaters. So they have a bunch of different lessons that they do for Triple P level 3. Level 4 can be either groups, usually it's 6 sessions plus 4 sessions of phone call, then they also have individual Triple P level 4. It's a behavioral intervention. So it focuses a lot on problem behaviors, how to respond to those using things like timeout or quiet time, positive reinforcement, and then how to monitor and maintain that improvement in your student. So strengthening families is one of my favorites. It's a complete program for the entire family. So I've been privileged enough to go and observe a lot of these sessions. You arrive and it's a very festive atmosphere where everyone's eating dinner together. I think that's one of the things the model emphasizes is let's start by positive family time, eating together, no TV, just focusing on each other, having a healthy meal. And then they learn some lessons. They break off into caregivers and students in another group. They learn lessons like how to communicate together with their caregivers and the students and vice versa. And then they'll come together back as a family to practice. And then we have the providers going around kind of coaching them to make sure that they use those skills. So if we look down under that, we also have case management. So that can be really brief case management. A lot of these services, they don't actually have to be open clients, so they don't have to go through the paperwork system. They can, just sign consent forms without going through a formal assessment. So case management is one of those very popular things. A lot of the SLS coordinators do a large amount of case management, but we also have these providers available to do that as well. The evidence-based practices on the bottom, these are tier 3 services. So our prevention and intervention program also does offer individual services as well. So trauma-focused cognitive behavioral therapy, motivational interviewing, and also family therapy. So to access these services, I talked a little bit about skill streaming, strengthening families. They'll often first ask their open clients if they would like to attend, and then they'll open it up to school or district-wide. Pretty much everybody prefers now to have it in person, so especially for the dinners. And so it'll be at one school site, they'll promote it, and lots of people can come even if they weren't initially identified by the school. The other services like the Triple P, level 4, the more intensive services, trauma-focused CBT, that most often happens where a school counselor or a teacher notices something or is concerned about a student, and they'll put in a referral, which usually goes to the schooling services coordinator, who will then send it to our contracted providers who will do an assessment and provide one of these services. So the prevention early intervention program does not have those eligibility requirements of having a diagnosis or needing higher level treatment. But our SLS behavioral health services are that outpatient, intensive outpatient level of care. So sometimes referrals that go into the prevention early intervention program get referred to our schooling services program. It's usually most often individual therapy once a week, sometimes twice a week at the school. They'll pull kids out of class and support them. They'll work really collaboratively with the teachers and the caregivers. And I think the big difference between our outpatient system of care, which can be in the community, they can serve at the school, but the majority of it is outside of school. These clinicians are really embedded at school. They'll be stationed the whole day. They'll know the counselors. They'll know the culture of the school, and then they can also see those students on school campus. We have expanded that program recently to include a higher level of care. It does have psychiatry. We now have case management opportunities for those families as well. Access is similar to how prevention of early intervention program gains access through the school, making referrals to the SLS coordinator, who send them to our county contracted providers. So this is some of our data on the number of students served. So as you can see, the prevention and early intervention program with its outreach really gets out there in the community, does all sorts of events, goes to classrooms. So we have 3,195 served there. 954 is more of the tier 3 services with the identified students, their open clients. A lot of them receive individual therapy. Some of them are more tier 2, like they're in a group, or they might just be receiving ongoing case management. But a lot of those also are getting individual therapy. And then 587 is the number of students who were in our SLS behavioral health specialty mental health services receiving the types of services that I mentioned. We also have a high rate of students who are successfully discharged. We like to call them graduates, graduated from the program successfully, so it's 83%. And then the child and adolescent needs and strengths data also came out very positive, showing improvement in behavioral emotional domain and life functioning domain. So here are some success stories. I mentioned earlier, my favorite thing is to hear from students. And so these are some quotes from students who received skill streaming. They had the providers come to their classrooms. You know, a lot of it is about mindfulness, self-control, how to calm yourself when you're getting angry. So you can see that quote. Thank you for everything you've taught us these past few weeks. Self-control lesson helped me a lot because I get mad a lot. So we've got literally dozens of comments from different students that are similar to this one. And as you can probably imagine, it just means the world to the teachers to have students be able to calm themselves in class. So they love that. And I think Lupe mentioned some data earlier about the satisfaction rate being very high of teachers. Here's another one. Thank you for helping me with my anger issues. I now count for 10 seconds if I get mad. My brother tries to get me mad, but I won't let him. So teaching kids to really prepare in advance. What are some of the things you know will make you mad? Okay, in advance, why don't we ensure that you're ready to count to 10? And they teach them a variety of breathing techniques as well. The last one on there is about the accepting no lesson. I also love this one. So sister keeps telling me, no, I can't play with her tablet. But the lessons that she learned from the providers and skill streaming, she didn't react by taking it away, which, you know, happens in the family where it then turns into a big fight. So that's a wonderful lesson to learn. I'm not going to read the whole success story, but the one under there, and these slides will be available, I believe, and as well as a recording. So the student was referred because she was having issues at school and at home. This is a collaborative model where the teachers are continually engaged to see if students are improving, not just things like attendance, but also behavior. And so they work on anger triggers, stressors, use positive self-talk. And by the time she successfully graduated, she was able to use those pro-social behavior with her peers, and she was moved along in middle school. So that's a success story for one of our individual services. And we have a lot of really beautiful examples of students who really turned around their life through this program. Thank you.
All right, thank you, April. Just to share with you, looking ahead in the future of SLS, as part of our Tier 1 services in the Family Engagement and Prevention program, we are continuing to outreach to remaining school districts that may not have an SLS coordinator to see if they would like to join in having an SLS coordinator. So as we shared, we're at 25 of the 32 school districts. And so we're just going to continue to outreach to those 7 school districts. And that way they can leverage county resources, build this learning community with SLS coordinators. We also will increase positive parenting programs, specifically the Triple P Level 2. Those are the 90-minute webinar or seminars that are available for parents. We're going to provide that more at different school districts. We are also going to incorporate mental health screening for third graders through the PEI program continuum. So a student may receive PEI screening, a mental health screening through the PEI program, then go through skill streaming, but also get connected for groups. And then if they are needing individual therapy, the student can remain within the program to receive all of those services. So that team would be staying with the youth as they go through the different services. Our early intervention, which is our tier 2 early intervention, we are also going to increase positive parenting program Triple P Level 3 to have available at more school districts. This will look like small groups for parents to really look at targeted behaviors and really get some support and coaching from a family partner or for a parent who has had lived experience. And then we will also increase skill groups and have that available for more students. Those skill groups are really essential to help ensure that they understand the fundamentals that they've learned maybe through the skill streaming, but needs additional time to practice them. Our tier 3 schooling services behavioral health program. So we are expanding the schooling services program to include intensive services, and that will also look like having paraprofessionals or family specialists working with students to really work on specific behaviors. We will also be expanding this program to newly identified high-risk zip codes. So behavioral health looks at 7 different risk factors that look at data to see where there is some high needs and approach school districts to see if they would like these services in their school. So we did a updated map, and that updated map did identify some new zip codes that we are outreaching to those school districts. And lastly, behavioral health, specifically our division, is looking at this partnership and efforts to expand access to school-based behavioral health supports and services. And through this, there's various projects that we are working on. So as of today, the school-based behavioral health wellness center grant program notice of financial availability is made available to all county school districts today. And that application process has begun starting today and will end towards the end of October. This is to help school districts build new wellness centers on school campuses, enhance existing wellness centers, as well as build infrastructure to support school-based wellness centers. Our next project and collaboration is with the County Office of Ed and Managed Care Plans. I did mention the Children, Youth, and Behavioral Health Initiative. It's a $4.7 billion budget from the governor's office to really look at reimagining mental health services, and especially around schools and with children. So there was a project that started about a year ago called the Student Behavioral Health Incentive Program, where wellness centers, workforce expansion, informational technology enhancement, and building stronger partnerships was the goal of that project. And that project has been launched, and there's 6 wellness centers that are being that has been opened since that project. And then lastly, the Children Youth Behavioral Health Initiative also includes another work stream called the Schooling Fee Schedule, and that's to launch in 2024. But behavioral health will be promoting the sustainability of the wellness centers, as well as expanding school-based services through this schooling fee schedule, and in hopes that the school districts will continue to build partnerships with community-based organizations, county departments, and the managed care plans, and they can provide services on school campus. There's more information to come about the fee schedule, but behavioral health will really look at supporting the school districts in getting this fee schedule started. So here's our contact information. If you have any questions about the program or about the different services that we have or the different projects, please feel free to connect with us. And then also, we will open it up for any questions and answers. Don't see any questions here in the room.
No questions in the chat.
Okay, no questions in the chat. So we'll give it a minute or so, and like I shared, we can have this presentation to everybody, and then any information you're needing, feel free to connect with us. She stopped sharing. All right, well, thank you so much for your time today, and we look forward to connecting with you if you have any questions. Thank you.